More Americans than ever are struggling with their mental health. Organizations and professions across the country have gone as far as to declare a mental health crisis. The U.S. Preventative Services Task Force, an independent medical organization, now recommends that all individuals under age 65 are screened for anxiety. The federal government rolled out the new 988 hotline, where anyone going through a mental health crisis can speak to a trained mental health professional. Government studies have also found that younger generations experience unprecedented rates of depression and suicidal thoughts. The bottom line is that we need to accept this new normal so that we can give people the assistance they need to move forward. How the SSA has ignored mental health. One part of the government that hasn't accepted the new normal, the Social Security Administration. If you have a mental health condition that leaves you unable to work, you can apply for Social Security disability benefits through SSDI or SSI. But the SSA isn't likely to approve your application. In the past 20 years, the number of people who got approved for SSDI for a mental health condition has decreased significantly. In 2004, more than 193,000 people got SSDI for mental illness. That number rose steadily until 2010, when almost 219,000 people were approved for SSDI. Since then, SSDI approvals for mental health have taken a nosedive. In 2022, only 61,000 applicants were approved for mental health. The total number of SSDI applications has gone down slightly in that time, but that doesn't tell the whole story. In 2004, a total of 2.6 million people applied for SSDI. In 2024, the SSA is on pace to get about 2.4 million total applications. But consider that in 2004, of all the people who were approved for SSDI, 25% were approved for mental health conditions. That number has declined almost every year since. In 2022, only 12% of approved benefits were for mental health. So, even though more workers than ever are struggling with mental health, and the U.S. acknowledges it has reached crisis levels, fewer people are being granted disability benefits for their debilitating mental health conditions. The SSA isn't the only one. To be fair to the SSA, other government agencies are also struggling to keep up. For example, workers' compensation covers medical bills and lost income for workers who cannot continue working because of a medical condition. Workers' comp laws are set by state governments, and currently there are 16 states that don't allow claims for a mental illness that leaves you unable to work. Another 9 states only cover PTSD, with some restricting even further to just first responders. If you live in the half of the country where mental health workers' comp claims are covered, you need to provide so much medical evidence that your condition is work-related that most applicants still don't get benefits. So the SSA isn't alone in failing to help workers who struggle with mental illness. What the SSA can do. Changes are also difficult. Increasing access for mental health would require the SSA to make some serious changes to how it currently works. Accept mental health conditions on par with physical health conditions. At the most basic level, the SSA would need to increase acceptance of mental health conditions as equivalent to physical conditions. In 2022, about half of people approved for SSDI had either cancer or a musculoskeletal condition. That includes clear physical conditions like arthritis or back pain that affects bones, joints, or ligaments. It's important for those individuals to receive benefits, though the SSA shouldn't ignore workers with other, harder-to-measure health conditions. Improve how it defines disability. If the SSA does decide it wants to expand mental health coverage, it often isn't as easy to test and measure how a mental illness affects someone. That means the SSA would also need to modernize the way it determines when someone qualifies. The SSA uses the Blue Book to lay out qualifying criteria for hundreds of health conditions. The Blue Book is a highly technical manual. It's also impressively vague on how to prove that a mental illness makes it impossible for you to work. For example, one of the criteria that SSA uses for arthritis is whether it requires you to use a walker or assistive device. That's a clear metric that an SSA examiner can test. Meanwhile, if you apply with anxiety, the SSA will look for extreme or marked limitations in your ability to 1. Interact with others, 2, adapt or manage oneself. 3, concentrate, persist, or maintain pace. And 4, understand, remember, or apply information. The SSA tries to explain what terms like extreme limitation mean, but if this is the requirement a medical examiner uses to decide if your anxiety qualifies, there is a lot of room for their personal opinion and subjective analysis. Loosen age restrictions. Mental health conditions are more common among younger disability applicants. Even with the SSA's current strict criteria for mental health, nearly half of disability applicants under 50 receive benefits for a mental health disorder. Across all ages, mental health conditions account for only 29% of conditions. For true equity, the SSA would need to expand benefits by approving more applicants who are younger or earlier in their careers. In 2022, nearly 3 out of 4 SSDI recipients were 50 or older. The SSDI program is open to people of working age, assuming that you've worked and paid taxes for at least 10 years. But SSDI has always favored older individuals. When disability insurance was added to Social Security in 1956, it only covered workers between the ages of 50 and 64. The program expanded to all workers in 1960, but the bias toward older workers nearing retirement age remains true. The SSA still uses an outdated list of jobs, but luckily this is one area they are making changes. In 2024, the SSA eliminated some obsolete jobs to bring at least one part of the SSDI application into the 21st century. 5 ways you can help your application. Well, you can't count on the SSA to make big changes quickly. Here are 5 ways you can improve your chances of winning disability benefits with a mental health condition. Number 1, make sure your medical treatments are documented. More than anything, your chances of getting disability benefits increase if you have clear medical records that your condition leaves you unable to do your job and that your condition continues to affect you even though you've received treatment for it. Medical records could include any treatment plans, test results, doctor's notes, and any other evidence of your medical care. Oftentimes, the more treatment records you have, the better. The SSA will look for care from a psychiatrist in particular, in addition to other doctors or psychologist treatment. Recent medical records, like from the past 6 to 12 months, can also help. Number 2, fill out a mental residual functional capacity form. This form explains the types of tasks you can and cannot do because of your condition. Request one from your psychiatrist. If they don't know where to get a blank copy, you can get one online. You can also visit or call your local SSA office. Number 3, don't forget about physical conditions. The majority of benefits awarded by the SSA every year are for physical conditions rather than mental health conditions. Include any physical conditions and symptoms that affect your ability to work, even if your primary condition is a mental health condition. If you can apply with a qualifying physical condition and include a mental health condition as well, it can help your chances. That said, do not lie on your application. If the only qualifying condition you have is for mental health, you're better off only using that. Number 4, understand what the SSA is looking for. The SSA checks for specific requirements in every application. That could mean particular types of medical records, certain test results, or key evidence of your inability to work. You can see what those requirements are in the SSA's Blue Book. This is a technical document that lays out what SSA looks for when considering certain conditions. And it isn't easy reading. That's why Atticus has broken down the Blue Book listings for most common conditions. If you know what the SSA wants to hear, you can use that to inform how you talk about your condition in your application. Number 5, talk to a professional. When you're starting a job you've never done before, it helps to have an experienced professional in your corner. Applying for disability is no different. In Social Security disability, those professionals are likely the disability lawyers and representatives who help people like you win disability benefits every single day. We know it sounds strange to talk to a lawyer about government benefits, but the disability application process is a legal process. For example, many applicants need to go through a hearing in front of an administrative law judge to get benefits. The best way to win a hearing is to work with a lawyer who understands the process inside and out. A good disability lawyer or representative will charge nothing up front. You only pay after you win benefits. At that point, you pay a one-time fee that comes right out of your back paycheck. That's money you would not have gotten unless you won benefits. If you don't win benefits, you don't pay the lawyer a cent. There's no catch, no hidden fees, and no reason not to request a free consultation today.